Funding for this edition of One-on-One with Steve Adubato has been provided by Wells Fargo, the Russell Berrie Foundation, Making a Difference, New Jersey Sharing Network, the New Jersey Board of Public Utilities Clean Energy Program, MD Advantage Insurance Company, the Northward Center, Georgian Court University, Fedway Associates, Inc., and by the Adler Aphasia Center. Promotional support provided by Jaffe Communications, supporting innovators and changemakers with public relations and creative services. And by AM 970, The Answer.
This is One-on-One. I'm an equal American just like you are.
The jobs of tomorrow are not the jobs of yesterday.
Look at this. You got this?
Here it is, man. Look at that.
Life without dance is boring.
I don't care how good you are or how good you think you are, there is always something to learn.
I did do the finale, and guess where my trailer was? A block away from my apartment. It couldn't have been better.
People call me because they feel nobody's paying attention. Start talking right now.
Such a good question. High five.
Welcome, everyone. I'm Steve Adubato. We're going to get into a very important discussion about ending racism with a longtime friend, Barry Ostrowsky, president and CEO of RWJBarnabas Health, also a board member at NJPBS, and DeAnna Minus-Vincent, executive vice president, chief social justice and accountability officer at RWJBarnabas Health. Good to see both of you.
Thanks for having us, Steve. Good to see you.
We've had many offline conversations, as well as I've moderated forums within the system talking about these issues. Barry, set the tone. What is the Ending Racism Initiative? And is that's Ending Racism Together, correct? That's the official name, right?
Yeah, we use that terminology, doing things together, in order to portray the fact that most of what we need to do has to be done as a team. From our standpoint, our mission is a simple one: make our communities healthier and provide better lives for those who live in our community. And as you know, we've addressed social determinants of substandard housing and food insecurity and chronic unemployment. But frankly, we'll never attain the goal of making our communities healthier and happier unless we address that third rail issue, the existence of structural racism. And of course, this last year of social justice visibility has promoted for us the absolute need to be very specific and focused. And DeAnna is leading us on this journey of dismantling the kind of structural racism that exists in our society, and frankly, the behavior that flows from that. And unless you do that, frankly, we're not going to be able to make our communities the kinds of places that people should be living in, happier and healthier lives.
DeAnna, A, what does it mean to you to be leading this initiative? And B, how do you tie ending racism or the issue of racism with public health? Please, DeAnna.
So as a woman of color, both African-American and Indigenous, I am so proud to lead this effort. It is both exciting and thrilling to change a system, but it's also daunting. It's something, racism, systemic racism, has existed in this country since its inception. I know that I always want to change immediately, but it has to be incremental change. And as we move through this journey, we see, as we're talking to our teammates, our patients, we see faces light up because it is something that we haven't talked about. It's something that we've kept hidden, and it means so much to so many people that we're finally bringing it to the fore.
And by the way, we're talking about this complex, challenging, longstanding issue of racism. We're also fighting the internet in the process because there's a little bit of a delay. But in all seriousness, Barry, talk about, and we've talked about this with DeAnna and other leaders within the organization, and RWJBarnabas Health is an underwriter of what we do. And I've done leadership coaching there, but this issue keeps coming up, which is the, if you will, the inequities, the racial inequities in terms of delivery of healthcare. Barry first, then DeAnna. What does it mean? Give us a concrete example of what that means.
Well, you know, Steve, one of the things about this particular issue and many others is it's predicated on facts. The data speaks clearly to the fact that people of color, and particularly Black people in this country, suffer from structural disadvantages when it comes to accessibility to healthcare, when it comes to the actual treatment of healthcare, which, by the way, is produced by those who are exquisitely trained, but in the training, there are racial biases. And so what you find is people of color who present at the emergency department do not receive the same level of pain medication on this ridiculous assumption that they're better able to consume pain than other people. The maternal child issues, the data around maternal death in terms of the Black community is outrageous.
Excuse me, Barry, African-American women are 7 times more likely to die in childbirth than a white woman. By the way, check out our interview with the First Lady, Tammy Murphy, who talks about that extensively. Barry, pick up your point.
No, that's right. And by the way, after childbirth, presenting in the emergency department with a post-childbirth issue is typically misdiagnosed and frequently is fatal. And so these are data points. This is not some social notion of just justice. These are data points that suggest clearly that people of color receive lesser, less frequent, and more inconvenient care. And unless we're going to fix that, we will never attain that which we set out to attain, which is to make communities of all peoples, of all colors, healthier and happier. So from my standpoint, the data speaks volumes about the need, and anyone who pushes this off as some kind notion is absolutely wrong. The data proves the need for this kind of focused attention and initiative.
DeAnna, how has COVID-19, as we tape this program later in 2021, how has COVID-19 laid bare the issues that Barry just laid out in terms of the racial inequities and the inconsistencies? Not the right word. It's way worse than that in terms of how people of color are treated in the healthcare system. How has it made it even worse?
I think COVID-19 has brought prominence to the issue. I think for people of color, we've always felt it. I think it has magnified it for people in the majority. It has some of the policies that came with COVID-19 were grossly inequitable. And I think when COVID-19 struck populations of color, we could no longer ignore the fact that systemic racism was a root cause for those populations being hit so hard. Everything from residential segregation to food insecurity, to chronic disease, to close living quarters, to being essential workers. And you could follow the track directly to COVID. And it was eye-opening for people. Even when you look at those of us who are more affluent, you had to look at the history of it. And as Barry laid out disparities in maternal child health, those things are not socioeconomic dependent. So we had to look at everything up close and personal, and we couldn't sweep it under the rug any longer. But in America, our memory is short. So I'm very fortunate to work for a system where we are continuing to push the needle and not just leaving it behind. So COVID did open the door to people's eyes.
DeAnna, I'm so sorry for interrupting. I just got about a minute and a half left. Real quick, the resistance to the vaccine in the African-American community. Real quick, Barry, and then DeAnna, 30 seconds less. How is that tied to the Ending Racism Together initiative? Because it's very real. Barry.
Well, it's reflective of a legacy of people of color assuming, and to a great extent based again on fact, that they were the subject of experimentation when we developed new approaches and techniques in healthcare. So there was this immediate skepticism that a vaccine that was rushed to the market, although with all the regulatory approvals, could well have been yet another attempt in some cases to ignore this imbalance in how we treated people of color in these developments. So I think that skepticism was appropriate. The facts, however, are persuasive that that wasn't the case, but it's a natural reaction, I think, if you're a person of color to this brand new kind of treatment for even a pandemic level illness.
And by the way, those experiments, if you will, healthcare initiatives, also sponsored by the federal government. A few seconds on this, DeAnna, before we have to go on vaccine hesitance. Barry laid out the historical context, but what do we need to do?
I think we need to build trusting relationships with communities of color, because there is a historical frame, but there's also lack of customer service and lack of trust and built in with communities of color. I mean, the issue of pain management, the issue of assuming that African Americans are drug seeking. So really, how do we bridge those relationships, and how do we do it in a sustainable way that doesn't just say we're doing it for you to get the vaccine, but that we're here, we're trying to make inroads, and we're in it for the long haul.
A lot of work to do. We'll continue the discussion. DeAnna, Barry, thank you so much for joining us. Part of our Confronting Racism, three-year-long initiative so far. We'll continue it. Thank you so much for joining us. Stay with us. We'll be right back.
To watch more One-on-One with Steve Adubato, find us online and follow us on social media.
We're joined by Marcus Sibley, chairman of the Environmental and Climate Justice Committee at the New Jersey State Conference of the NAACP. Marcus, you joined us on a previous segment. There was more to discuss. I want to follow up on this. You said in a previous segment that the NAACP is not partisan, does not get involved in elections per se, but you are political. Again, I want to understand that a little bit more.
So we don't endorse candidates because we are a nonpartisan organization, but we understand that laws run the land. So when you know that, it is your job, it's incumbent upon you to establish relationships with your political officials so that you can help drive legislation. We've been instrumental in the passing of the independent prosecutor bill, most recently marijuana legislation, previous to that ban the box. It's important for us to be present. The recent cumulative impacts law that came into law for environmental justice, we were also instrumental in that. We're behind the scenes. So we're having the conversation. So the community doesn't always see the work that we're doing, but we're behind the scenes making sure the people who represent us are well aware of the concerns of the community.
So I want to follow up on that. So changing of, there are states all across this nation, led by Alabama, Texas, okay, so many others, that are changing and again, the history of the Civil Rights Movement and the Voting Rights Act. Research it if you don't know what that means, and I'll put it in perspective right now. There are many who say, we just want to change the voting law so that you can prove who you say you are. But there are others who argue that there's a lot more going on there, and it's potentially something that's nefarious and dangerous by changing the requirements of people to vote and the potential implications of who our representatives will be and will not be moving forward. Not to mention that people will not be able to vote who previously fought so hard for that right to vote. They're being disenfranchised. Go ahead, Marcus. I know there's a question there. I think there is.
Well, I mean,
got a lot on my mind there. Go ahead.
Well, what you're pointing to is the problem, the age-old problem that Black people have had in this country is proving that we belong and proving that we're citizens. And unfortunately, there's always hoops. There've always been hoops when it comes to us displaying or proving our need to vote, because we understand that in this country, the vote is what matters. If you can vote on it and it becomes a law, that becomes a new culture. So every time there's been an opportunity for us to get a larger a response to voting, anytime we've been able to get more people to the polls, immediately following that election, there's always been tactics to now reduce the amount of people who can vote. So this
you think that's the motive? I'm sorry for interrupting, Marcus. You believe, contrary to what many of those who are leading the effort to change those voting laws, we're just trying to make elections more fair and honest. You're shaking your head because?
Not at all, because if people wanted to be fair and honest, they will be open to as many people as possible participating in the voting process. But they've consistently, it's a playbook. Every time there's been a larger outpouring of Black and Latino votes and LatinX votes, they always come back with new, stricter laws to make people prove that they're citizens. And the most simple thing we should be able to do in this country is vote. We're able to pay bills from our smartphones. We're able to watch this show from a smartphone, but we're making it harder to vote. Like, it doesn't add up. And it always comes back to maintaining white supremacy. That is always the baseline. We can't allow more people to vote, because if more people voted, then we're going to vote out the people who are maintaining the white supremacy. So we have to stop that. And it's always worked. It's always worked.
Real quick, I say January 6th, connected to race or not? Go ahead.
100%.
100%?
100%.
Devil's advocate. Excuse the double entendre there. So January 6th, just a bunch of people who wanted to make sure that the rightfully elected president, Donald Trump, was put into office, and that Mike Pence, then vice president, quote, did the right thing and whatever he was supposed to do. And we questioned the results. It was a fixed election. It was rigged. It was the race? Really?
Yeah, it's connected to race, because one, you see white privilege on full display. There was a tried and true method to elect the leader. And when these individuals, when their person didn't win, then I need to exercise my right to show you that what you did was wrong. And now I have the power to come to the Capitol and show you that's what you did was wrong. And because of my presence, something is supposed to change. And that's connected to race, because every Black person in the world watched that and said, how quickly would that have been a massacre if we were even on the steps? Because even coming on the steps was off limits. So to go from the steps—
What about breaking into the building? What about threatening members of Congress and threatening to kill Mike Pence?
So that's how it's one layer connected to race.
What about going after cops?
And it's also 100% on that as well. But it's also connected. It's also connected to race, because what does "Make America Great" mean? Like, what does it mean? Make it great again? It means going back to a time where the whole diversity thing wasn't an issue, and this whole people taking our jobs.
But not for everyone, Marcus. Not for everyone. I mean, there are a fair number of people who want to go back to what they think when America was great and it was a better country and we competed. See, you're connecting greater to whiteness, aren't you?
I'm connecting greater to a lot of people's definition of great is when there was segregation and people look like me had to go to the back of the bus or go around the back of a restaurant to get food and get nourishment.
You think that's what Donald Trump was advocating?
100%.
No doubt.
No hesitation at all. People forget Donald Trump had a history of poor race relations long before the White House.
You mean when he was building housing and there was a court case in which he and his father were building housing in Queens and they had to pay the federal government back because they were barring Black people from renting in their apartment? I'm just stating
that's one of
fact. I'm sorry.
That's one of the many cases.
I read a little history. That's right. Listen, Marcus, I'm sorry. I'll get off my soapbox.
But that's the thing. But that's why this is connected.
30 seconds. Finish up.
No, I was just saying, environmental justice is important because everything that's happening in our communities is a byproduct of racism and white supremacy. So that we have to attack environmental issues with the same fervor and passion that we attack social justice issues. And that's what we're doing right now at the New Jersey State Conference, NAACP.
Marcus Sibley, I want to thank you so much for joining us. We appreciate it.
Thanks so much, Steve.
Stay with us. We'll be right back.
To watch more one-on-one with Steve Adubato, find us online and follow us on social media.
We are honored to be joined by Rosa Zaremba, who is founder and president of the Mexican Alliance of New Jersey, and also a Russ Berrie Making a Difference Awardee. Rosa, so good to see you.
Thank you. Thank you for having me here.
Tell us exactly what the Alliance is and its connection to the Berrie Awards.
Sure. So the Mexican Alliance of New Jersey, or we go by MAO of New Jersey, because we're open to everyone, not just Mexican or from the Mexican background roots. And the Alliance was really formed to help students, high school and college students, to navigate the system, the pathway to high school, college, what's after college, the thinking of really experiencing an overall well-rounded understanding of what potentially they can go into a career or find a way. Many of them, they are stuck in between going to a 4-year college, 2-year college. They don't want to go to college. What options do they have? So everything that we brought in, and we figure let's focus on those 2 segments. And really bring in different types of programming and work with high schools, colleges, professionals in different fields to bring broad perspective to the students and really educate them, inform them what their opportunities are, as well as along the way helping the parents, which we never really took that into account, that we would be helping the parents understanding what does education mean? And when that came into play, we were asked to do a lot of bilingual workshops to really help with the parents and bring them in and inform them to what extent their kid or children had when it came to education. So that's the overview of what the Alliance is. And like I said—
And by the way, Rosa, I'm sorry for interrupting. We're going to put up the website so people can find out more about the Alliance. And also, we've been affiliated with the Russell Berrie Foundation for many years. And part of our mandate is to feature leaders in the not-for-profit community that are making a difference. And you and the organization were recognized as an honoree, correct? Making a big difference.
That was an amazing, unexpected award that really helped us, because now we're actually in the process, thanks to those funds, we're in the process of creating a new series that is with the STEM-related field. So this year we were able to give out 3 scholarships. Last year we did 1. This year, thanks to that award, the Russ Berrie Award from Ramapo, we were able to give 3 awards to different, some freshman students in college, and some are ready to graduate college, and they really needed the aid. And like I said, we're working on doing some STEM programming that includes coding, the basic of coding, science, experimenting, research, and all of that.
By the way, the STEM, science, technology, engineering, and math, and also the Russ Berrie Award is, in fact, a cash award. They're at different levels, but I just wanted to clarify that. Real quick, before I let you go, Rosa, your experience, could you briefly describe the challenges you faced as a teen coming to the United States?
Sure. So I'm a proud immigrant. I came here when I was 11 and a half with my mom. I did not know any English. We didn't have a lot of family. And going through, I did have the opportunity. Somehow I ended up going to a really good school district here in New Jersey. And thanks to my teachers and my guidance counselor, they really pushed me. I graduated with a almost 4 GPA from high school, and my guidance counselor was the one that pushed me to stay here and go to college. And at that time, I didn't know anything about scholarships, FAFSA, what type of aid was available out there, and what type of colleges and what type of aid they would be able to provide to me. So I applied to one because I thought that's the only thing I can afford. Luckily, I ended up getting 4 scholarships that paid 2 of my years in college. And from there on, I just worked 40 hours a week. And once I graduated college, I took a step back and said, wait a minute, what is going on? And taking really the time now, I tell everyone, be involved in college, find any clubs, any groups, any networking, talk to your professors, see what advice they have, what type of internships. So that's basically where the idea of the Alliance really came out of New Jersey, because that's what we learn. And a lot of first-time generation college students, they go through the same process that I went through. I'm the first college graduate in my family, and knowing that I can help other students in the same. And we have students who are Latino, Caucasian, and from other.
Rosa, I'm sorry. I'm so sorry for interrupting. We're tight on time. That's one of the problems. So ultimately, you're making a difference because?
We're making a difference so we can help other students get to their ultimate goal and really trickle down to the second generation to change and break that through the same way that, chasing and running, just trying to pay the bills. And we're trying to break that and show them what opportunities they have.
Rosa, you're making a big difference. Keep doing what you're doing, and we'll follow the work you and your colleagues are doing at the Alliance. Thank you so much for joining us.
Thank you. Thank you for having me here.
Our honor. I'm Steve Adubato. Thank you so much for being with us, and we'll see you next time.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by Wells Fargo, the Russell Berrie Foundation, New Jersey Sharing Network, the New Jersey Board of Public Utilities Clean Energy Program, MD Advantage Insurance Company, the North Ward Center, Georgian Court University, Fedway Associates, Inc., and by the Adler Aphasia Center. Promotional support provided by Jaffe Communications and by AM 970 The Answer.
How do you create change? By cultivating hope. And we see that every day. In the eyes of our preschoolers, in the souls of the seniors in our Adult Day program, in the minds of the students at Robert Treat Academy, a national Blue Ribbon School of Excellence, in the passion of children in our Youth Leadership Development Program, in our commitment to connections at the Center for Autism, and in the heart of our community, the North Ward Center, creating opportunities for equity, education, and growth.